The acutely disturbed patient presents in an excited, agitated, or aggressive state. There may be delusions and perceptual changes like hallucinations that overwhelm the patient. Disorientation and alteration in consciousness are often prominent when the cause is organic. The patients are usually brought in restrained by more than one person or by the police. The condition must be regarded as an emergency since a few cases are potentially fatal. Causes for acute or functional psychiatric disorders. Main causes are mania or hypomania, schizophrenia, and like states. Other psychotic disorders, agitated depression, acute psychosis. Also, for acute organic psychiatric disorders, main causes are um, toxic psychosis secondary to drug intoxication, amphetamines, cocaine, marijuana, heroin, and others. And also, normal reaction to alcoholic intoxication. So, acute alcoholic withdrawal syndrome, as in delirium tremens, and infective causes, for example, typhoid, malaria, meningitis, HIV, encephalitis, and hepatitis. So acute metabolic disorders like hypoglycemia, thyroid disease, and porphyria. Others are head trauma, and also subdural hematoma. So symptoms: sleeplessness, restlessness, agitated or even combative patient. So talking excessively and loudly or low-toned, reduced speech, even mute in some cases, disinhibited behavior or speech, hearing or seeing imaginary people or objects, expression of fear, undue suspicion, inappropriate guilt, or bizarre beliefs, also distractiveness. So the signs that are usually elicited are elated, irritable, angry, or depressed mood. And also other signs of the specific disorders, and physical aggression, agitation or restlessness, lack of insight, pressured or retarded speech, hyperactivity or reduced motor activity, disinhibition, social or sexual, delusions of grandeur, guilt or paranoia, auditory hallucinations, visual hallucinations, especially in toxic, infectious, and withdrawal states, fever, as infective conditions, drowsiness, altered consciousness, mainly in alcohol withdrawal, disorientation and confusion, mainly in alcohol withdrawal, sweating, tremors, mainly in alcohol withdrawal too. So the investigations are urine screen for substances like amphetamine, cocaine, heroin, cannabis. Usually none is required. And also FBC, rapid diagnostic tests for malaria parasites where there is fever and suspected infections, random blood sugar, and blood culture. The main treatment objectives are rapid tranquilization to calm down the patient as quickly as possible using the safest drugs available without necessarily inducing sleep, to treat underlying cause. Non-pharmacological treatment: you restrain patients when necessary without causing injuries. Talk to the patient in a firm but reassuring manner. Also, avoid long periods of silence, especially in paranoid patients. Remove and store away any offensive weapons on or around the patient. Pharmacological treatment: you give lorazepam IV or IM in adults for 2 to 4 milligrams start, and repeated once after 10 minutes if necessary. In children more than 12 years, you give 500 micrograms to 2 milligrams, the maximum dosage of 4 milligrams. Less than 12 years, you give 500 micrograms to 1 milligram, the maximum dosage of 2 milligrams. Or you can give haloperidol IM in adults 2 to 5 milligrams that you may repeat in 4 to 8 hours with a maximum dosage of 20 milligrams per day. In children 13 to 18 years, if 2 to 5 milligrams 4 to 8 hourly as required. And 6 to 12 years, we give 1 to 3 milligrams 4 to 8 hourly as required with a maximum dosage of 0.15 milligrams per kilogram per day. Less than 5 years is not recommended. So the patient should be switched to oral as soon as possible. So this, then you give haloperidol oral in adults 3 to 5 milligrams 8 to 12 hourly with a maximum of 30 milligrams per day. In children more than 12 years, you give 3 to 5 milligrams 8 to 12 hourly as required. The maximum 30 milligrams per day. 3 to 12 years, you give 15 to 40 kilograms 0.25 to 0.5 milligrams per day. The maximum 0.5 milligrams per day. And less than 3 years is not recommended. You can also give chlorpromazine IM for very agitated patients. In adults 50 to 150 milligrams start, repeated after 30 to 40 minutes if necessary. In children 12 to 18 years, give 25 to 50 milligrams 6 to 8 hourly. 6 to 12 years, give 500 micrograms per kilogram 6 to 8 hourly with a maximum dosage of 75 milligrams per day. And 1 to 6 years, give 500 micrograms per kilogram 6 to 8 hourly with a maximum dosage of 14 milligrams per day. Never give chlorpromazine intravenously. It may lead to severe hypotension, so it should never be done. Or you can also give olanzapine IM in adults 10 to 20 milligrams that subsequent doses of 10 milligrams may be given 2 hours after initial dose, and if necessary then 4 hours after the second dose with a maximum of 30 milligrams per day. Children is not recommended. And you can also give chloral hydrate oral or rectal in adults 500 milligrams per 1 gram to 1 gram. In children 12 to 18 years, give 500 milligrams to 1 gram. And 1 month to 12 years, give 30 to 50 milligrams per kilogram with a maximum dosage of 1 gram. Neonates 30 to 50 milligrams per kilogram. Or you can give diazepam IV in adults 10 milligrams slowly over 2 to 3 minutes, approximately 2.5 milligrams every 30 seconds. And children 200 to 300 micrograms per kilogram slowly over 2 to 3 minutes, and this may be repeated after 10 minutes if necessary at a maximum dosage of 10 milligrams. Or can give diazepam rectal in children more than 12 years 0.2 milligrams per kilogram. 6 to 12 years 0.3 milligrams per kilogram. 2 to 6 years 0.5 milligrams per kilogram, and 1 month to 2 years 2.5 milligrams. Neonates 1.25 to 2.5 milligrams. You may repeat this after 10 minutes with a maximum dosage of 10 milligrams. If a rectal formulation is not immediately available, draw up the injectable form directly into a syringe and administer it into the rectum after removing the needle. So diazepam IV must be administered with care if the cause of the acute disturbance is thought to be organic. So referral criteria: refer all acutely disturbed patients to a specialist.